No, it's recording. Sorry.
Oh, it is now?
Yeah. Because I stopped it for break and then.
I think she wants it continuous in case you edited it or something.
No, that's fine.
Thank you.
This is all the Carrollton group. Guys, split up. This is.
We got 3 over there. Yeah, I've got 3 over there.
We don't know chloride, so we're not going to go there. We're not going to learn it. We're just going to.
Take about the next 5 minutes or so. Try to work on this.
So what am I writing? Oh yeah, I heard it.
'Use whatever resources you have.
Wait, regular I had to get she says next.
Good time.
They're all falling asleep.
4 is what medication is used to decrease levels of potassium. Calcium is looking at fixing the rhythm. And then looking it up.
It's all in our heads. Our heads are computers.
Okay.
Our heads are computers.
Some of these are hard to find.
Okay, so you're on the
One of the important Take another 2-3 minutes, speed up.
severe hypertension. Tell me what's wrong. Aren't you supposed to have like weakness on board? I know you're supposed to.
Yeah, that was my thought.
It's decreased with the, is it on top? Affects the potassium.
You're defeated, like,
We can have
Yeah.
understood, but
How's everybody doing?
ooh, you're just.
on the header.
It's a hard one. Huh? I was hoping you were going to come up with some answers.
Luckily, I thought I had one.
All right, if you see some that don't have answers or small groups, if you don't want to try to help them out. All right. Duck call. Time's up.
Well, you got, that's
Oh, yeah, I
some
woke you up.
toys in your pocket,
Yeah,
huh?
I got toys everywhere.
So you're.
All right, so we'll start over here with sodium. If you guys could pick somebody to go over the electrolytes. You guys get to say it out to the class.
Sorry, we're in a place. Sorry, we're in an equation.
Oh, all right, no problem. All right, so sodium, if you guys can pick somebody, or if you want to each take a turn, just present your findings to everybody.
Sodium, normal 135 to 145.
All right, what type of IV fluid is used to correct hyper or hyponatremia?
For hyper, 0.45 or dextrose and 5%. Or 5% dextrose and 1.
Okay,
For hyper?
so
Okay.
for your hyper, you can do some loop diuretics, you can do like Lasix, you get water PO. For hypo,
Hypo is non-saline.
yeah, you got your 3%.
Only 3%.
That's given in like 10 minutes times 3. So the next question, what's the appropriate rate?
There's whatever's ordered.
Oh, yeah, equation, awesome. All right,
So for hyper, you do the total water deficit equals the total body water, and then you times it by 1 minus the desired sodium over their serum sodium.
good.
And
So
then-
if it's hyper and it's been said that it's acute, which is generally less than 24 hours, then you want to treat it rapidly. If it's chronic, great, then you want to do it a little slower because you can have brain edema. All right, the next question.
Food restriction, where you would see an order for that if they had like congestive heart failure, fluid overload, or syndrome of inappropriate antidiuretic hormone.
All right. All right. Yes, the patient without signs and symptoms of dilute urine, asymptomatic. Then you want to. All right, the next one on sodium levels, affect neurostatus.
Confusion, hallucinations.
The chances are they're probably not going to be able to read what level on the garage they're on. I'm on level 4. They're probably going to be so confused that they're not going to be able to And it could be so many other things that, and sodium imbalance is usually the last thing you're going to think about. So, all right, good job. All right, we'll move on to potassium.
Okay, so normal is going to be 3.5 to 5. As far as cardiac issues with potassium imbalance, we said that you have a really high chance of getting some arrhythmias, especially like the dangerous ones, you know, the tachypnea and all that stuff.
Absolutely.
Into potassium. 2, how is it related to acid-base balance? Hypo and hyperkalemia can lead to acidosis. There's supposed to be a down arrow there on 2, but then, you know, it's okay. I just said it. So.
Back to number 1. What's one thing on like an EKG? One common thing you'll see at times.
Peak T
Peak
wave.
T's. Right. There you go. Awesome.
Let's see, 3.
All right, 3.
What precautions must be made when replacing potassium orally and IV? We said you need to put them on a cardiac monitor first.
Okay.
We also said make sure that you actually check their potassium levels before you replace anything.
Right.
PO causes GI upset. Make sure you warn the patient about that. Maybe have a small meal beforehand.
Okay.
And the Cater pills are actually they're like horse pills. They're really
They
big.
are. They're big.
So if they have any sort of difficulty swallowing that, ask the doctor for the powder version.
Okay.
We also said IV. Let them know that it does burn and make sure that you dilute it so they don't freak out and their veins don't get messed up.
It's not uncommon to see some burning and redness on their arm. You can slow the rate down. And you can also, like I said, you can run other fluids with it if they're not on fluid restriction. Right. As far as orally, just want to comment on that. We get a lot of our potassium from what we eat, and a lot of people try to use salt substitutes. It's important not to use salt substitutes when you're taking it because it's got potassium in it. So that's a key point too.
We also said make sure you check to see if they have any kidney issues. If they have renal disease, talk to the doctor about it. Number 4, what medications are used to decrease levels of potassium and how do they work? So we have diuretics, and you just pee it out, and KX late, you poop it out. And that's basically it that we got.
Okay. There's also, in the emergency department, there's also a way that you could try to decrease some electrolytes. There's a combination. You can give like D50, you can give insulin, you can give bicarb. You give all those at the same time, and it decreases a lot of the electrolytes, to include potassium. All right, good job. All right, magnesium.
Okay, for our reference range, it was 1.5 to 2.5. Possible side effects or intestinal problems. It's used, some symptoms used to try and promote bowel movement and diarrhea. Vasodilation can cause some hypotension issues. It will, if you have too much magnesium, you can have decreased reflexes, ear retention, and then you can see some cardiac arrest.
Some other uses of magnesium, you'll commonly see it to help with seizures. You see it on L&D. They give it to preeclamptic patients. They also give it to try out with patients to delay labor, so their cervix can ripen. So different uses of magnesium. All right, good job. What's your next question?
Okay, so it was like what other electrolytes can influence magnesium and vice versa. And magnesium can affect calcium homeostasis. And then so it would, calcium and magnesium compete for. And then hypocalcemia and hypokalemia also often follow hypomagnesemia.
Okay, great point. So you can also have just the magnesium itself can help boost some of the other electrolytes. Play a strong role in trying to recover somebody with the electrolyte imbalance. Just the magnesium itself, because like you said, they kind of work together. Then you also, all right, did you go on number 3?
Cardiac abnormalities. Oh yeah, so cardiac abnormalities. In hypermagnesia, you can see widened QRS and extreme hypotension along with arrhythmias. When we were looking this up, and just based on our knowledge, it often said arrhythmias, but really this said
the textbook, magnesium torsades, exactly. So you got torsades, and it kind of looks like VTAC, but it narrows. It's related to looking like a tornado. It's pretty. Yeah, you want to work fast though. Don't look at it too long.
And then in hypotension, not hypotension, hypo, you use the tachycardia and ventricular rhythm. And then it said like how fast should you give it, and the rule of thumb is 1 gram per 30 minutes, and magnesium always needs to be.
All right, wonderful. You guys did a good job. Thank you. Chloride, you're up.
Normal range is 96 to 106. Number one, was related to the acid-base balance, so remember too much, you have metabolic acidosis or compensated respiratory alkalosis, and then it's not enough, it's related to acids, so it's CHS, gastric surgery. How does chloride affect other electrolytes? Chloride lowers sodium. That's always fun. And then what system affects chloride production? Just was talking about renal system.
Absolutely.
And then we didn't find it before. How does chloride affect the patient?
So your chloride, so your anion gap is where it compares the cations to anions. So it helps to identify with metabolic acidosis. So the higher, if it's higher than normal, then it's called high anion gap metabolic acidosis. So you guys just look up anion gap and I'll try to fill in those blanks. All right, who's up? Calcium?
Normal range 8.6 to 10.2. Calcium, acid-base balance, bone and calcium, and relates to, it acts as a buffer for acid loads in the body. How it relates to other electrolytes. Calcium, phosphorus, yeah, and her relationship with phosphorus. What rate is it infused? 0.3 to 2 milligrams per kilogram per hour. If it's continuous infusion, then I guess there's other rules if it's, what it's being used for. And best way to increase calcium levels, biphosphonates, liposome, IV fluids and diuretics if it's an emergency, so just flush it out.
Excellent. All right, we got last but not least, phosphorus.
Okay, so phosphorus, our normal range is 2.5 to 4.5. As just kind of stated, it's in inverse relationship with calcium. Function is calcium regulation and maintains pH and tissue oxygenation. So when the levels are low, how does it affect the patient's organs? Well, we're just going to talk about tissue oxygenation. You can have CNS dysfunction, muscle fatigue, cardiac problems, and it also affect the excretion of the magnesium and calcium. What are calcium phosphate deposits? Those are your kidney stones. One of the ways we get kidney stones. Okay. And the phosphate infusion rate is less. We found the number to be less than 10 milliequivalents an hour. Is that weight based or anything?
It's usually over 6 hours for infused phosphorus. It's weight based, 2.5 milligrams per kg. You can give it faster, but it says the response can be unpredictable. So I would give it. All right, you guys did a great job. I want you to. You got 2 minutes. I want everybody to get everything they want off a piece of paper. 2 minutes. We're going to turn you nurses into aircraft engineers. I want you to try to take that piece of paper and make it into an airplane. Everybody come over here and see who can throw it furthest out of whatever engineering you come up with. Ready to go.
It's good to use the right side of your brain and get creative. Been using enough of the left side.
Whatever airplane you design. Everybody come over here. No.
Bill the table come. Well, get over here. I remember the sticky on the top there on the back.
However you want to do it. You guys are the engineers. The optics, fly further. All right, we're running out of time. Just got a few more minutes. Second touch. All right, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. All right, everybody pick somebody. Come up here, this side of the wall. Right across the room. Y'all ready?
Good job, Alex.
Wow, that looks good. All right. Y'all gonna throw all at the same time. You ready on the count of 3? 1, 1, 2, 3. Throw.
Somebody threw a
All right.
ball.
So why did I do that?
So we won.
The whole reason of, all right, so this one get the furnace?
The gyrosphere got it.
So the ball, I didn't say it had to be, it looked like an airplane.
Thinking outside the box.
That's right. And then also,
Thinking outside.
symbolizes that despite the fact that you're able to recognize all these findings with electrolytes, depending on your patient, it's plain it represents the patient. No matter what you do, each patient's going to respond differently. So you get all this information together, you treat them, you let the patient soar and see how they respond. And they can either do really good, keep going, or they're going to fall short. So everybody, and each one of those was different. So each patient's going to respond differently to your treatment. I had a good time with that. All right. So we're going to move on. It's out of time. All right, so we'll go over this quickly. I'm sure you guys are already aware of this, mostly from school. These are just cool little color handouts that you can have. You need to review your acid-base balance, how to, read ABGs. All right, so all of those would help you try to figure out respiratory acidosis. This is how the patient's going to look. Can't catch your breath. And it'll go through different signs and symptoms that you'll see with that type of patient. All right, next one. Respiratory alkalosis. Again, you read through those. I gave them on your handout. I was going to spend more time with it, but we'll just keep going. Metabolic acidosis. Metabolic alkalosis. All right, I got these in color. It helped. Because black and white, you wouldn't quite get the idea. All right, homeostasis and body elimination. All right, so you guys did your... All right, so fluid balance, non-obese patients, intracellular fluid constitutes about 40% of body weight, extracellular is 20%. So I'm sure there's more to fluid balance than just these two. You've got like third spacing, some other components, but just, hypervolemia and hyper and hypovolemia. So those are the things that you just need to, we're just going to touch base on briefly. So what will these patients look like? So I know these pictures don't look like a patient. This comprise how the patient might present. So hypervolemia, which means fluid volume overload. They're going to have a lot of fluid, so they're going to have weight changes. They're going to have, the reason for that could be because they have kidney, renal problems. They may not be eliminating their urines. They've got all this fluid buildup. So then you got your edema. You have, usually if the patient is able to stand and walk around, you're going to see fetal edema. It's going to be more on their lower legs. I've seen it go all the way up to their thighs, but if they're mobile, walking around and not bedridden, you'll see it more on their legs. However, if they are in the bed, you can see it all over their back, on their buttocks. So, lungs, if you have hypervolemia, you'll end up having potentially some breathing problems. You have extra fluid there. There could be cardiac problems that are relating to that fluid volume overload as well. So all things to look into. So hypovolemia, some things to think about. Again, kidney problems. Everything relates back to your kidneys. Tinting is one of the things you can try to help diagnose if they're hypovolemic. Meaning that their skin turgor will be done. Their weight changes as well.
Everyone's checking their skin.
Yeah. See if they're dehydrated. So no, we got labs and stuff. That's kind of a quick way of assessing it. But so kidney, it plays a key role with weight and with dialysis patients. So keep that in mind. Renal failure. Hyper and hypo, what's important? Intake and output. You want to make sure you document accurately. Hey, the tech, you make sure you communicate. Just because your techs are there to help you, and they dump out the urine and don't tell you, it's important at the change of your shift to find out who your tech is. Make sure you communicate. Hey, I'm monitoring ions. I need to make sure I have an idea of what their output is. Communicate that, as accuracy is important. Other places you can get intake and output. You got Foley's, of course your urine. You got stool, NG tube, however much you got out. They got a GI bleed, you're putting or valve obstruction, you're putting an NG tube in and you're hooking it up to low intermittent suction to try to decompress their stomach, as well as try to keep them from throwing up stool. That's great. You're putting that in there to try to decompress their stomach, but you need to document that. Tube feedings. If you got they can't swallow, they had a stroke, you got a tube going out in their stomach, you need to document how much fluid they're getting. Blood transfusions. Have we ever talked about? I don't know if we talked about that or not. Okay, so volume. You got your volume from your blood. Daily weights. If you're working in a critical care setting, and some new other hospitals have your ability to zero your bed, you can check your weights on your patients before the patient gets there. Make sure your room's ready. Zero your bed. Flour, it just saves a lot of time. Dialysis, if your weight's going to change before and after. Dialysis. Skin care, depending on if they're hyper or hypovolemic, you can do a lot to their backside or to their heels, or to their elbows if they're bed bound. Just things to think about. Vital signs. Whether you got too much fluid or not enough, it's going to make an impact. Again, output, drains, your chest tubes. Wherever they got fluids going out or going in, you need to chart it. All right, some types of fluids used to treat fluid imbalances. You got crystalloids. There's all different types of those. LR, NS, you got all, this is just kind of a quick form. Colloids, you got albumin, dextran. And then, of course, you got blood products, fresh frozen plasma, packed red blood cells, platelets. Things that can affect fluid balance. You got chronic renal patient. I think I'll put that on there. It's going to talk to you about things that are happening with that patient and how that their inability to make urine or a small amount of urine can impact their acid-base production, their fluid electrolytes, their breathing. Everything. All right, what else could affect fluid balance? Sepsis, diabetes, shock. Teresa's going to be touching base on shock. So, just key points to think about. All right, in closing, look, another video.
Imagine your child tells you that when they grow up, they want to be a servant. What would you think? Maybe they have low self-esteem. After all, servants change sheets. They do work most will not. They pick up after others. They clean up after accidents. Servants take what's worn out and make it last another 30 years. Servants change sheets and hearts and minds and history and tomorrow and how many birthday parties there will be. Servants change everything.
You knew it, huh?
So, a lot of people had a hard time with this. I'm not a servant. I'm not the wait staff. Don't view it as that. Servanthood. It's one of our vision and values, Baylor Scott and White. And still, we work as a team, we make a large impact on people. Welcome to Baylor. Glad to have you guys. Appreciate your time. All right, so next we're going to do a quick eval. Here's some references. All right, so this should be a good time. Everybody got phones? Use your computers, phones, etc. We're going to take a little quiz.
As well, yeah, you do you want the paper one too, right?
Okay.
This is something else.
You just copy the link and go.
I'm going to have to go online. Hopefully. Stand by one, Houston. Appreciate your patience.
You're doing that pretty quick, Dave. I'm impressed.
Sound. This is sound free. Should be free. All right, well then,
You got a game or a
yeah.
quiz?
Everybody can log in on your phones. Go to Kahoot it. I don't know where my sound is. It's going to ask for the game pin 513216. Got 3 players logged in, 4.
Go, go, go.
Nobody has it. If you can, I got pretty good connection. If you don't want to use your Wi-Fi, you can just use your regular phone connection. 7. We at least got a member from each table.
It's asking for personal phones.
All right, we got 11 in there. All right, 13. Let's get started. I'm really upset I don't have any sound. All right, so what you guys need to do is you need to enter your answers.
There you go.
Enter your answers. It's based on accuracy. All right, if you weren't able to log in, just work with somebody beside you. So it's going to be based on accuracy and how fast you answer it. All right, you guys ready? Next question. What? All right, so who won?
2.
We got MG and Christine. All right, good job. Question 2.
That's fine.
How many lives are saved from one kind of blood? 20, 3, 15, and 1. People got it right. Good job. All right, Christine still on the lead. Baylor second. Question number 3. The single most important function of a nurse related to blood administration is getting coffee from Starbucks, checking the blood at the nurse's desk, verification of the patient's blood products, policy, getting a tech to check the blood.
Possible kind.
Verification of patient's blood products for policy. All right, good job. Majority on that one.
Still Christine at Starbucks. Who's Christine?
MG and Baylor. I know some of you think login, so it's not quite accurate.
Chris and Christine.
All right, question 4. What is the most important when it comes to blood transfusion reactions? Have a small variety of ways to stop the transfusion, check the vital signs 20 minutes after turning blood, stand there and watch the reaction. Alright, 17 was the answer.
Somebody knocks it.
Alright, good job. You guys are making an A on this. Christine, what happened?
It's a fluke.
Third. Alright, question 5. What's the leading cause of mortality in the United States for blood transfusion reactions?
Oh, I did.
Taco Bueno, trolley, taco, or trolley. Leading cause of mortality, Taco Bueno.
It's an open book test, I guess.
Trolley.
Ooh.
Oh, we had some messages on that.
Taco or trolley?
One of them.
Taco's number 2, trolley's number 1. All right, Baylor, Christine, back up there. All right, question 6. As nurses, how can we help to monitor a patient for document accurate audios, give the NPO, patient fluids, just pour the fluids down the toilet. Just as the tech, just as the tech. What all this stuff on there? 2, 1. Document accurate.
Yay!
Just a couple more. Baylor, Christine, still hanging in there. Who's Christine?
Dual pair over there.
Dual team.
Who's Baylor?
Who is
All right,
Ah, the new guy.
metabolic acidosis causes DKA, severe constipation, shock, and renal failure. Metabolic acidosis causes what? Use your resources.
They are. Severe constitution.
Hey, look at that. There's 3 of them that are right. I kind of switch it up. Baylor, Christine. All right, a couple more. What are ways to give patient an auto-transfusion cell saver, a level 3 infuser, give them another unit, blood bank, start them all in the same thing.
Yay.
Hey, that's great. Wow, this sports are, you guys are getting close. All right, last one. One thing to remember with all patients is all patients everybody responds. See who the winner is?
Baylor.
Baylor. Well, thank you very much.
Who was Baylor?
I enjoyed,
Who's Baylor?
The new guy.
The new guy.
enjoyed my time with you guys.
I know.
Everybody wins.
Everybody
Feedback
wins.
results, let's see. All right, well, thank you very much. I've enjoyed myself.
All right.
Hope you guys were able to learn something. I do have an eval that I need completed. If you have any tips or anything you guys want to comment on my presentation. Thank you for your time, and sorry I carried over quite a bit.
Thank you very much.